surgery day. 6:30 a.m. Huh, Gobble? Yeah. You excited? No. Not happy. Look at the bubbles. Whoa. They really take care of you, don't they? Can you get up? You gotta get those bubbles? Alright, so I just left Gabriel with the medical team. And that was tough. There's really nothing that can prepare you as a parent to hand over your little baby into someone else's hands. You're basically putting your child's life into their hands. I don't know. That was definitely tough to deal with this morning. I had to hold back the tears because that was just really hard. Just giving up your kid and saying, here's my child, please don't let him die, basically. I'm just waiting in a big waiting area here at the hospital, and there's pretty lights and stuff. So that's been the morning. So I hope and pray that my son's procedure goes well and everything goes okay and the anesthesia goes okay. That's my biggest fear, of course, but everything else, no complications and everything. So we'll see. So I'll know in, I don't know, a few hours or so. They gave me a pager to keep with me, so they'll notify me when he's out of the procedure and everything and communicate, you know, throughout the procedure, I guess. So that's where I'm at right now. So I just got a page from the team. Looks like everything is going well. Or going well. That's how you want to say it. So as I'm waiting, I came across this little thing. Magical caution door, no touchy. It's just in this giant wall. I was like, what the F? What is that butterfly doing in there? Okay, so I looked a little closer, and look, there's fairies, insects, birds, bats, wing. Oh my gosh, you guys, that's great. That's just perfect. Alright, time for the doctor consult. Sounds like he is done with surgery. Woohoo! Alright, I had the consult with the doctor. All went well. I'll explain the details later, but now Gabriel is ready to be seen by his mama. Can't wait to see him. Alright, we are in recovery. He's nibbling on a cracker. Doing good. We did a little bit of breastfeeding already. Ate a popsicle. Yeah, now we're watching Frozen 2, his favorite. So, doing well, just waiting on a bed upstairs. Oh, you little gas? Oh, honey. Oh, I know, he's got stuff coming out all over his body. Not fun. Not fun. Look at all the tubies. Alright, we are officially in his room that he's going to be staying in for the next night or two. And we're just doing a little bit of nursey. Yes, always helps. He's pretty much fallen asleep right now. So, yeah, so we're just hanging out and letting him rest. And I'm going to try to get some lunch here soon. I'm starving. But anyway, yep, we're doing good. Little guy sleeping. And this is my setup. I'm gonna watch the presidential inauguration on YouTube. This is the cool little pull-out bed. I don't know if it's too bright, but that's the view. The city view. And a sunset. How nice. Yep, so just hanging out and just letting the little guy rest and heal up. And I'm gonna watch the inauguration. Alright, it's dinner time. Oh, I know, here. He's been eating pretty good, actually. He had a few bites of mac and cheese and chicken nuggets and some oranges earlier. And now he's having some peaches, making a mess, and some peas and carrots, and maybe some turkey sandwich. I don't know, we haven't tried that yet. I don't think he's gonna eat the turkey though. Yummy, yummy. So this is good. Seems to have a decent appetite despite having surgery today. Huh. Oh, and don't forget the chocolate cake. Alright, so I just wanted to kind of go into a little bit more detail as to what my son's surgery is all about, why is he having surgery, all of that. So basically what happened was I had a growth ultrasound at around when I was 35 weeks pregnant, I believe, around that time, because I wasn't measuring big enough for that time frame, and they just wanted to make sure that he was growing well inside of me. So we did a growth ultrasound, and the ultrasound tech discovered through that ultrasound that my son had an enlarged kidney. The tech didn't seem too concerned about it. I'm like, what are you talking about? Kind of like freaked me out. But basically he was diagnosed with what's called hydronephrosis. So I talked to the doctor after that ultrasound, and she basically said there's nothing we can really do, nothing to really worry about right now. We'll set you up with a specialist after he's born. So we were set up with a specialist, and I think we saw them a couple of weeks after he was born, maybe a month or so. Anyway, so we saw a specialist, a urologist, and basically what he thought was, and he thought it was basically a common issue. It's not something that's super, crazy or alarming or anything. But what he thought was that he had a pinched ureter that came off of the kidney. So basically the pinching of that ureter caused the kidney to enlarge and retain fluid, and it just causes the kidney from releasing that fluid at a normal rate. So the kidney eventually would release the urine, it just took longer. So over time, basically too, what happens is that kidney kind of remains or becomes enlarged as well, like I mentioned. So anyway, his poor little kidney, his left kidney to be exact, would just retain urine basically and just drain it out really, really slowly. So the thought was that, again, it was just like a little pinch in that ureter that came off of the kidney. They didn't want to do the procedure too early on, so basically we just monitored him for at least 15 months, because he's about 15 months old now, yeah. So he's just been monitored throughout that time. He did have a kidney drainage test, I believe, to see kidney function test, just so they could determine that the kidney was still was healthy and the kidney tissue was still healthy and everything. And it turns out that was fine, and that was determined to be fine. Now, one thing we did too was a special test where they inject contrast into the kidney, and they also administer a diuretic to basically detect if any of the urine would go back up into the kidney, because if that were the case, then he's at a higher risk for kidney infections. And they actually wanted him to be on antibiotics regardless of not regardless of the test, but basically we opted to have that test so he wouldn't have to be on antibiotics. So if we didn't have that test, then he would be on antibiotics the whole time, just to prevent and reduce the risk of developing a kidney infection. And me as a dietitian, I'm like, I don't want my kid on antibiotics for that freaking long. I don't want him to develop issues with his microbiome and everything. So we got that test, and thank goodness nothing was regurgitating back up into the kidney. So we said, okay, great, then we don't have to do antibiotics. So that test was thankfully a blessing. So anyway, so his kidney function and everything was monitored, and the size of the kidney and everything. So anyway, it came to he turned, I think, about 13 months old for a checkup, and the doctor was just like, he's big enough now, he's healthy. It looks like the kidney is still enlarged. I think they
he was hopeful that the kidney, that it would fix itself basically over time, that the little pinch or whatever that they thought was there would just resolve, and of course that didn't happen. So the doctor determined that it was a good time to schedule this surgery to repair it. So yeah, so the surgery, like I said, went well and everything. We're on the other side now. One thing is, there's a little plot twist actually here, because what they thought occurred was not the case. So the little pinching of that ureter, that's what they thought was the issue, turns out was not the issue. So let me explain actually what they discovered. All right, so I know you can see me in the reflection. What's up? This here is what, or it's an illustration, of course, obviously. If someone should hire me to do comics or something. I'm quite the artist. Okay, enough of that. Anyway, this is what actually, I tried to remember exactly what the doctor drew for me when he explained it. So I'm gonna try to hopefully explain this exactly how he explained it to me. So what actually happened, what they actually discovered when they were in surgery. So here's the kidney, of course. Here, oh yeah, here is the ureter from the kidney. Like I mentioned, that this is what drains into the bladder, which I did not illustrate, but drains into the bladder down here, all the urine that's collected in the kidney. And then here is, apparently I learned this, that there's two veins that supply blood to the kidney. I know this, again, this is probably not, if you open up an anatomy book or something, this is not correct, but anyway, try to give you a visual here. So there's two veins that supply blood to the kidney. Now, what apparently happened was one of the veins actually was grew kind of really close and on top of the ureter, which caused it to basically pinch off that ureter. It basically obstructed the ureter. So it caused that blockage and prevented the kidney here from draining the urine into the through the ureter into the bladder. So super interesting. So anyway, what happened was, what they did was they actually did a procedure, but the procedure that they would have done anyway, even if it was just a pinch or something up here. So what they did was and again, I'm going to do my best to explain this, but they rerouted the ureters. So basically what they did was let me get the little marker here to extend this out. They cut out this piece here and rerouted it to go basically like around, oh man, I'm not gonna do this right, or above kind of the vein. So the vein kind of comes out the backside here. Does that make sense? Yeah, I think that looks right. So that's what they did. So they cut it out and then they rerouted it and reattached it. So that way the vein kind of goes in the back, or at least it prevents it from pinching, obstructing the ureter here. So that's basically what they did. The best illustration of this ever. So anyway, that, you guys, I learned was what happened. So I know I'm making like a big deal about this, but it's really fascinating. It's really it blows my mind, all of this, like that these doctors can work with little tykes, little babies that are just small, and that they can, cut them open them up and discover what's going on, their little baby kidneys and ureters and all of that. So anyway, it's just like, I'm amazed, and I'm like super thankful. Everything went well, and just such a huge blessing that he was in really good hands. So he's actually taking a nap now. I can't believe he hasn't woken up from my voice. So let's go say hi. There he is. He actually fell asleep not too long ago, but he was fighting that nap for sure. He finally fell asleep. I bet he's gonna be out for a while. So that's the little dude. Okay, well, that is it for now. We are still waiting on discharge. We talked to the surgeon, the doctor, his urologist, and he said basically if he's peeing okay and eating well and there's adequate drainage coming from the wound, the surgical site, that we should be able to leave today. So I'm hoping that is the case, because I did not get good sleep here last night. Of course, you get woken up by the nurses and the noises and stuff, but there was a freaking vent right above my bed, and it was like blowing cold air on me and my face, and I just like couldn't breathe well. Anyway, I could complain on and on, but so I just did not get any sleep, so I need some rest. So anywho, I hope we get to go home today, so we will wait and see. Bubble, what is that?
Bubble.
It's Bubble? Yeah. Oh, we're doing good. We just met with the team. He seems to be doing good. They pulled out his catheter and what else? Oh, they disconnected his IV line. So steps are going in the right direction. They also gave him a suppository to help his bowels return to normal function. And the hope is for him to have a bowel movement hopefully today, but probably won't happen until tomorrow or later. But and then just we need to see if he'll go pee on his own and everything. So that's what we're waiting on. So just hanging out. All right, he's trying to escape. What are you doing? This is your first time walking since surgery. Hey, no. It's not like a bracelet or something. Yeah, look at you. Look at you. Oh goodness, a little wobbly. Look at the view. Wow, there's a cemetery down there. Pretty though. Pretty view. All right, we're just walking around. He's starting to walk, get some steps in. Yeah, but he wants to leave. He wants to go outside. He keeps pointing to the window. But yeah, where do you want to go? You want to see the other windows? You want to go to the other windows? Hmm? Yeah, so nice to get outside the room for a change of scenery. Here we go. All right, little dude wants to go. We are finally officially out of here. We get to discharge. Woohoo! Yay! We are going home. So it is post-op day number 2, I believe. Yes, so we got home last night, and Gabriel's been doing really good. He's been like playing, walking around, basically behaving like himself. So I'm really happy to see that coming home from the hospital. And as far as pain control goes, we gave him a dose of Tylenol before bed just to kind of cover him throughout most of the night so he didn't wake up in pain or anything like that. But since then, we haven't had to give him anything. Like, he's been totally normal, not whining or crying, or doesn't seem to be in any sort of pain at all. So we're happy about that. And we do have some stronger medication that they gave us, stronger pain meds, but we're probably not going to ever touch those. So I'm glad about that. He's doing really good in that regard. He did sleep through the night, which is awesome. I didn't think he would. I thought he would wake up crying or whatever, but he did sleep through the night. And he's been eating good, and like I said, just kind of behaving like his normal self. And as far as the wound goes, the surgical site, there's not a whole lot we have to do. As far as I know right now, there is just like glue tape or something. Like there's no stitches as far as I know. It's like a glue type stitch that's keeping the wound closed. And then on top of that, there's steri strips. And then on top of that, there's some gauze with some tape. And basically, it sounds like things are just supposed to kind of happen on by themselves. I don't have to do a lot of hands-on with it. Like the clear tape that's on top is supposed to peel away. And then I can remove that. And then those steri strips are supposed to come off on their own as well. Or after 2 weeks, that's when I can help pull those off. But otherwise, it's pretty basic. Not a whole lot going on with the wound. He can take baths, but he just can't. The wound can't be submerged in water, so he can be sitting in like a shallow amount of water, and we can let water. If he gets splashed on, that's no big deal. But so that's good. So he definitely needed a bath last night when he got home. The only thing too is he can't be on any bouncy toys or anything like that. No straddle toys where he's like jumping up and down. Obviously no roughhousing with his older brother, which has been kind of hard to manage, but no, they've been doing good together. So, and then he can go back to daycare after like a week and a half or so is my understanding. But anyway, otherwise he's doing really good. Just like I said, he's behaving like normal. He's just back to himself, like nothing happened. So that's really encouraging, and I'm happy to see that. So if you guys have any questions about the surgery or anything else, please let me know, of course. And if your little one is going to be having a surgery similar to this, comment down below too. I'd like to kind of hear what's going on in your guys' world and your little one. I pray that your guys' surgery goes well and your little one heals up quickly and all of that. But anyway, thanks as always for your love and support. I really appreciate you all. So with that, I'll let you guys go. Thanks for stopping by. Thanks for watching. You guys take care, and I'll see you again next time. All right, bye.